What role do many genes play in common hypertension? Imagine your body as a complex orchestra, with many different instruments working together to keep your blood pressure in check. Now, think about how tiny changes in the music sheet, or in your genes, can throw the whole performance off. That's what happens with common hypertension. It's not caused by just one gene, but by hundreds of small genetic differences that influence how your body controls blood pressure. Many genes are involved because they affect different parts of your body that help regulate blood pressure. For example, some genes impact the kidneys, which control how much salt and water stay in your body. Others influence your blood vessels, making them more or less flexible. There are also genes that affect hormone pathways, like the renin-angiotensin-aldosterone system, which helps manage fluid levels and blood vessel constriction. Certain genes, such as those called angiotensinogen and angiotensin-converting enzyme, play a role in this system. Variations in these genes can make it easier for blood pressure to rise, especially if combined with other risk factors like a high-salt diet or lack of exercise. Some genes also affect how your body handles salt and potassium, which are key electrolytes. If your genes make you salt-sensitive, your blood pressure might spike more than usual when you eat salty foods. Other genetic variations influence how your body responds to stress or inflammation, which can also raise blood pressure over time. When you have a family history of hypertension, it means you might have inherited some of these genetic variations. But it's important to remember that genes are just part of the story. Lifestyle choices like eating healthy, staying active, maintaining a healthy weight, and not smoking can help lower your risk, even if your genes put you at higher risk. Understanding that many genes contribute to hypertension helps doctors identify who might be more likely to develop it. It also guides personalized treatments, as some medications work better for certain genetic profiles. Scientists are working on new drugs that target these genetic pathways directly, aiming to treat the root causes rather than just lowering blood pressure temporarily. So, in simple terms, many genes work together to influence how your body manages blood pressure. They affect your kidneys, blood vessels, and hormone systems, all playing a part in whether you develop hypertension. Knowing about your family history and making healthy lifestyle choices can make a big difference in managing your risk and keeping your blood pressure in a healthy range.